Helping a pregnant cat during labor. If you have a pregnant cat, queen, and it looks like she is ready to birth her kins, queening, chances are that you will not need to do anything except encourage her. You may even wake one morning to discover that your cat has given birth during the night and is comfortably nursing her kins. Although nature has a way of taking care of itself, you should know how to spot potential problems and what you might need to do to help. Signs of impending labor. The duration of a cat pregnancy is roughly 60 days, give or take 5 days. If you are not so sure how far along your cat is, review the telltale signs that birth is imminent. Featured video. The ocelot. Facts about the endangered cat. Nesting. The day or two before labor, your cat will seek out a quiet and safe place to have her kins. She may choose a spot you make for her or look to hide out in the back of a closet or under a bed. Behavioral changes. You may notice your cat will begin restless pacing, panting, excessive grooming, especially in the area of her genitals, and excessive vocalization. She will also stop eating. Physical changes in labor. Your cat's rectal body temperature can drop to about 100 degrees Fahrenheit and it may vomit. You might see the abdomen drop a few days before labor, and the cat's nipples might get larger, darker, or pinker. Active labor signs. Contractions. The uterine movements that move the kin down the birth canal may make your cat yell through the pain. You may also see a discharge of blood or other fluids. Supplies for the birthing. Your cat might want to hide to give birth. However, you can prepare a birthing area, such as a cardboard box or laundry basket lined with towels or blankets too. If the cat uses this spot, it will be easier for you to observe and attend to the birth. Absorbent pads. Get absorbent pads to line the delivery area. Towels. You will need clean towels or paper towels to clean the area and stimulate the kins, if necessary. Nesting box. If you have brought your pregnant cat to the vet and you know how many kins to expect, get a nesting box large enough for the brood. An average litter is about 4 kins, although a cat can have from 1 to 12 kins. The standard 8-pound cat should be fine with a box that is 16 inches by 24 inches. The larger the cat, the bigger the box it will need. Heating pad. Put a heating pad in the bottom of the box with a blanket or several towels over to prevent the kins from getting chilled. Never place the kins directly on a heating pad. It can burn them. If the box does not have a lid, then drape a clean towel over the top to hold the heat in and keep out drafts. Refuse bin. You will have a bunch of soiled towels after the birth, so have a laundry basket, plastic bag, or extra box ready for discarding them. Dental floss and clean scissors. If the mother cat does not break away the umbilical cord, you will need to tie it off with dental floss and cut the cord 3. The kin birthing process. The trigger for the birth process is unknown, but factors include the size and weight of the uterus, size and weight of the fetuses, and the hormonal balances of the fetuses and the queen. During the birth process, rhythmical uterine contractions gradually increase to push the fetus out of the uterus and into the birth canal too. The birth of one kin can take anywhere from 5 to 30 minutes. The kins are born within their amniotic sacs, which the queen will remove. The mother cat will stimulate the kins to breathe by washing them with her rough tongue. She will also sever the umbilical cord by chewing on it approximately 1 inch from the kin's body. She may also eat the placenta too. The kins will immediately gravitate toward a nipple, latch on, and nurse. If the mother cat ignores the kin and it is still in its sac, you will need to carefully cut or tear the membrane pouch and stimulate the kin's breathing by rubbing its nose and mouth gently with a rough, dry towel. If the mother cat has difficulty biting off the umbilical cord, tightly knot dental floss around the umbilical cord 1 inch from the kin's body and cut the umbilical cord on the mother's side of the tie. If a placenta does not come out with each of the kins, make sure it expels within 24 hours after birth. Each kin should have 1 placenta. It is a good idea to count the placentas. If the placenta remains in the cat, you will need to see a veterinarian. About 30 to 60 minutes may pass between births, but more prolonged periods are not uncommon. 3. If there is a delay of over 2 hours and you are sure there are remaining kins, the queen needs examination by a veterinarian. Whether the birth went smoothly or not, the mother cat and kins should be examined by your veterinarian within 24 hours of birthing.